Hi everyone! Our group is interested in researching music therapy in relation to NICU patients. In this presentation, we will introduce our research question and give a brief overview of the topic. In addition, our main findings will be presented, including an appraisal of one of our most significant articles. To conclude our presentation, we'll discuss the implications of the research findings to nursing practice. Hi, my name is Amber Hybeck, and I'm the Technology Director and a Research Appraiser.
Hi, I'm Courtney Long, and I'm an editor and also a research appraiser.
Hi, I'm Madison Hadaway, and I'm the graphic designer and research appraiser.
Hi, I'm Legene Bogarty. I'm the team coordinator and research appraiser.
Thank you for watching our research project.
Our research question was, is the use of music therapy effective at reducing pain in neonatal intensive care unit patients? In PCOAT format, our population is NICU patients, the intervention is music therapy, while the control comparison is no music therapy. The outcome that we are interested in is pain relief throughout the length of hospital stay in the NICU.
In our own words, music therapy is the use of music as an intervention in various settings to promote positive patient outcomes and goals. The music can be live or recorded and instrumental or song. The important point with live music is that it must be performed by a certified music therapist. We also want to be careful to not overstimulate the neonate. A soothing lullaby sung softly or played on an instrument is the preferred choice. In the next slide, we will watch a short clip on how this music therapy is conducted in a NICU setting.
Music therapy in general is using music to address everyday goals and objectives. Here specifically, we like to work on pain management, feeding facilitation and feeding behavior, as well as heart rate and oxygen saturation. We created what we call a song of kin, and they start to sing that to their baby when things are nice and calm. Basically, if the baby's really fussy, so today he was really fussy because he wanted his milk. And so we started singing the Song of Kin to try and get him to remember, oh right, this is the time when I calm down. As I'm doing all of that, I'm constantly looking for signs of overstimulation, because we do not want the baby to be overstimulated. Then everything we've done basically goes out the window. We did some feeding facilitation with Miles, and I used the Gato box, which is a major third, and it simulates the heartbeat. It's also really great for sucking behavior. And so what I do is I pace with him when he's sucking. I start out, each suck, I tap the Gato box, and I entrain with him. And then as he's going, he starts to entrain with me so that I can get him to pace and suck, swallow, breathe. Yeah, he's very comfy.
Oh, hello.
Hi, buddy. He's opening his eye. Baby Silas, he has just started to be able to get music therapy. I've been going in and just singing for about 10 minutes at a time with him. He's so young that right now guitar would probably be too overstimulating. But as he gets older, I can keep doing music therapy and do it for longer periods of time. And it's also great for language development as well as neuro development. So if we can just get a really nice, calm, relaxing environment, it helps everybody.
Now that we have a basic understanding of what music therapy is, it's important to discuss the relevance of this topic to our nursing practice. It is well known that NICU babies undergo many painful procedures during the duration of their care on the unit. Being exposed to frequent painful stimuli early in life can have long-term behavioral and stress response changes. Pain management in the NICU is a vital part of care. As we will discuss later on in our presentation, music therapy can be effective in stabilizing physiologic function in the neonate. This alternative method of pain management is not only economically sound, but an easily available and relatively uncomplicated intervention for NICU nurses to apply.
We are now going to move into discussing the research on our topic. On this slide, you can see our search criteria for our literature review broken down by group member. We used several databases, with Galileo producing the most results. Our main limits for this search included at least one nurse author, full text, published within the last 5 years in English language. Finally, our search terms varied, but the main terms were neonatal nursing, music therapy, and pain. If you would like, you can pause the video to take a look at our finding table, covered over the next 4 slides. Don't worry about getting bogged down with details of the slides. We will present the major findings from these studies in the following slides.
The first study we are going to talk about is a narrative literature review of the therapeutic effects of music upon childbearing women and neonates. This research was concerned with the effect of maternal presence on music therapy in preemies of the NICU. It was a randomized controlled trial with a sample size of 50 determined by power analysis. 25 of the NICU babies received the music therapy with their mother present, and 25 of the babies received music therapy without their mother present. A significant finding from this study was a decrease in oxygen saturation and quiet sleep when the mothers left their infant during music therapy. This study suggests that music therapy in combination with the mother's presence might be more beneficial than music therapy on its own in keeping a NICU baby physiologically stable.
The next study we found significant was one by Carolyn J. Hollins Martin, called A Narrative Literature Review of the Therapeutic Effects of Music Upon Childbearing Women and Neonates. The objective of this article was to summarize the benefits of music therapy in relation to reducing stress, anxiety, labor pain, and depression in childbearing women, as well as improve neonatal outcomes. It summarized findings from several carefully selected articles that had to do with their topic. One article in particular discussed the effects of non-nutritive sucking accompanied by music on heart rate and pain behaviors. The sample size of 27 was randomly divided into the intervention group and the group with no intervention. After a heel stick, the neonates' heart rates were significantly reduced and the pain behaviors were improved.
Another significant study is the effect of music therapy on pain response in blood sampling. This study is conducted on 20 infants in a university hospital. A clinical crossover study was conducted in which the same infant was utilized for both experimental and control group. One arterial draw was done with music therapy and one without music therapy with at least 1 day between draws. It was determined that a significant difference exists in pain reduction in patients that receive music therapy versus those that do not. The patients with therapy had a significantly lower heart rate, more relaxed sleep alert cycle, and less distressed facial expressions. However, the study did not show a significant impact on oxygen saturation. Overall, various indicators of pain in infants can be significantly reduced when applying music therapy before, during, and after blood draws.
The article we chose for our appraisal was titled The Effect of Lullaby and Classical Music on Physiological Stability of Hospitalized Preterm Infants. Now we will begin to go through each step of the appraisal. The purpose of the study was to compare the effects of lullaby and classical music on physiologic parameters. In order to obtain the sample, all preterm infants admitted to the NICU from April to September 2012 who met the study inclusion criteria and had parental consent for inclusion were enrolled. The inclusion criteria included gestational age between 28 and 36 weeks, birth weight of 1,000 to 2,500 grams, and passing the otoacoustic emission screening test. The exclusion criteria of the study included congenital or anatomic malformations, confirmed central nervous system or heart disease, sedative, opiate, and anticonvulsive medication use before or during the study, mental retardation, or hearing loss in the family history. 25 stable preterm infants actually participated and contributed data. There were several methods used to collect data during the study. Observation was started an hour after feeding, and data were collected for 40 minutes in 3 phases: baseline, intervention, and post-intervention. They did not handle or do any procedures on the babies during the collection period. Every patient was studied during 6 consecutive days. The observations were conducted with 2 cameras focusing on the baby and the pulse oximeter. Infants were put in supine position in the incubator. They used an Iranian lullaby, a folkloric song, and 20 minutes of part of Baby Mozart CD. 2 speakers were put in the corner of the baby's incubator, 30 centimeters from the baby's ears. They set the decibels to run between 45 and 50. The music was allowed to continue for 20 minutes. Video recording continued during the entire study and for 10 minutes after and before the music stopped. The control group was recorded by video only. The videotapes were reviewed by a single researcher. During the 20 minutes, O2 saturation and heart rate using pulse oximeter were recorded every 2 minutes. They also recorded respirations for a full minute based on abdominal movement every 2 minutes. Finally, the researcher took these same measurements before and post-intervention as well. As you can see on this slide, a total of 25 infants were randomly assigned by intervention sequence to 6 groups. Here is a depiction of the main results of the study. As you can see, the baseline physiological parameters did not differ between the groups. There was no significant change in O2 saturation between the intervention groups. However, heart rate in the lullaby groups had significant reduction in intervention and post-intervention phase. The Mozart group had a reduction in heart rate only during the intervention phase. Reduction in respiratory rate was observed in both intervention and post-intervention phases.
This was a peer-reviewed article found on the Journal of Neonatal Perinatal Medicine website. The design was appropriate for the research question because it used a randomized control study, which is best when evaluating an intervention's effectiveness. The data obtained and the analysis conducted answered the research question because the data revealed that lullabies are most effective at reducing heart rate and respiratory rate in preterm infants. The authors did not mention if the measuring instruments were reliable and valid. In relation to extraneous variables, the authors discuss that the hearing test they did not recognize neural hearing loss. They tried to control for it by considering hearing loss risk factors and inclusion and exclusion criteria. However, it was impossible to control for all extraneous variables. NICU noise may have affected infant response to music. Amount of nutrition was not equal for all infants. This may alter their behavior and physiologic patterns. Also, parents were not present at all the infants' bedsides. All of the findings were reported with a p-value of less than 0.05. The means are reported in the previous table and are consistent with the reported findings. The lullaby group showed more consistent effects on heart rate and respiratory rate. Findings are consistent with other studies as mentioned earlier. We would have liked to see a power analysis ran to determine the sample size.
Next, we will discuss clinical significance. The target population is clearly described. Recruitment criteria for the population was mentioned in the inclusion and exclusion criteria. Overall, the findings are clinically significant in treating premature babies in the NICU. Physiological stability is a key aspect of care during a NICU stay for a premature infant.
Overall, all of the studies included premature infants, 28 to 36 weeks gestation, and less than 2,500 grams. Music therapy was performed before, during, and after invasive processes. The NICU infants had music therapy with and without the presence of the mother, during HIL-6 and during arterial blood draws. It was concluded that music therapy should better the outcomes for the NICU patients. The patient showed improved heart rate, stable respiration, less facial distress, and less stress/anxiety as evidenced by a more relaxed state. The evidence also showed improved results with the presence of the mother. Overall, it appears that a support system along with music therapy can have an improved outcome on the progress of the premature infant.
Implementation of evidence-based protocol would include use of music therapy before, during, and after invasive processes. The use of music therapy will aid the infant to cope with the painful processes during its stay in the NICU. One way to implement music therapy is to have the music subtly come on during and then play for 5 to 10 minutes before the invasive procedure, during the procedure, and 10 to 15 minutes after the procedure. At the end of the music therapy, the music will decline subtly and then phase out. We should see an improved outcome for infants in the NICU based on improved vital signs and other markers.
We have decided that further research is needed on this topic because when we searched the databases, we found that there weren't too many articles related specifically to pain and music therapy with babies in the NICU.
Possible further research which include quantitative studies focusing specifically on music therapy and reducing infant pain. Some of those studies would include crossover studies, cross-sectional studies, longitudinal studies, and this would give us an opportunity to establish immediate and long-term benefits of pain control in the NICU patients.
In conclusion, this topic has a lot of clinical significance. If we can find ways to reduce infant pain levels and improve comfort measures using non-pharmacological methods like musical therapy, it would be unethical not to utilize them.
And this concludes our presentation. We hope that it was insightful, and the following slides contains our references.
Thank you.